Hi, I'm Dr. Stephen Tonks. I'm a vascular surgeon here at Premier Surgical Associates in Knoxville, Tennessee. As a vascular surgeon, we treat multiple conditions throughout the body. Basically, any problem in the plumbing that you can have between just below the brain to the tips of the toes, we treat everything in between. So veins, arteries, aortas, carotids, fistulas for dialysis, myriad of problems we can solve. I grew up in a small town and went to Auburn for my undergrad education, where I received a Bachelor in Science in microbiology. I went on to medical school at University of Alabama in Birmingham and then completed my general surgery and vascular surgery residency and fellowship here in Knoxville at University of Tennessee. Some of my family had a background in medicine, and so I was just always sort of geared toward science and healing and that kind of direction. So it was just sort of a natural fit as I went through my educational training. I just sort of always knew I was going to be in medicine. I wasn't sure what until I got a little bit closer, but I found vascular ultimately. Throughout my entire life, I've always liked to work with my hands, and being in the field of medicine, surgery was a natural fit as far as being able to apply my individual skills and talents to physically help patients, not just treat them with medications. Vascular surgery is a little bit unique because we are able to develop a long-term relationship with the patients. Almost like a primary care provider where we see them throughout their life. Oftentimes vascular disease is a systemic condition, and it's a chronic ailment that we sort of help the patient manage and treat throughout their life. I do like to treat multiple areas of the body. Particularly enjoy treating lower extremity arterial disease as well as veins. Carotid disease is certainly an interest of mine, as well as aortic pathology, including aneurysms. Vascular disease is important to stay ahead of. You don't want to have a catastrophic problem because you've delayed treatment. It's important to identify issues that you may have and stay ahead of them. An ounce of prevention is worth a pound of cure. My philosophy of care is to treat all patients like they're your family or friend. I like to be able to relate to the patient on a personal level, explain things in a way that they can understand, and have a back and forth discussion so that we're both on the same page. Outside of work, I have quite a lot of hobbies, probably too many. Currently, I've got a bit of a fixer-upper house, so I'm doing a whole lot of carpentry work. I also like to obviously spend time with my family, walk my dog, and just spend time in the outdoors. It's one of the greatest parts about East Tennessee. Some of my friends and staff colloquially refer to me as Honky Tonks, both because my last name is Tonks and it rhymes, and I do wear boots in both clinic and in the operating room. It's not for style or for fashion, it's just because they're comfortable. It's what I trained in, what I've always worn, and that's what you'll probably see me in. What I would like patients to know about me is that I'm a down-to-earth guy. I like to relate to my patients on a personal level and understand their goals and their challenges and concerns as well. If you do have any pain in your legs, cramps, aches, itching, burning, swelling, feel free to call us. We'd love to see you, and we can help you get to the bottom of it. You may not know exactly what it is, but we can certainly help.